I'm glad to be standing here in your midst. Now, before I proceed, I promise there will just be just one eye-sounding vocabulary in my presentation, and I'm going to start off with that. And I'm wondering if there's anyone in the audience that has an idea what a scotomaphobia means. Anybody? No, of course, except for my three children who helped me in the preparation while I was preparing for this talk. But basically, and well, I would excuse you if you have no idea what it means, because not until I started preparing for this talk did I get to know that there was such a word for the fear of blindness. And most of my work revolves around this. So fear of blindness is scotomaphobia. Now, the beautiful thing about fear is that as you run towards it, it runs away from you. And most of my activities revolve around that. The blindness is not just the loss of vision. The thing that happens in blindness is the loss of your immediate space, such that most times you cannot begin to create your own place, and eventually, technically, you may be referred to as being non-existent. A lot of people have tried and have succeeded and have fared well, coping well with loss of vision or visual impairment. And I'll take you on a journey this day. I'll start my discourse with the story of Mr. Moses, a 75-year-old retired police officer whom I met during one of my home visits some years ago. Prior to my encounter with him, I'd met with his wife in the living room of their small apartment, and after exchanging pleasantries and after introducing myself to her, she mentioned to me that her husband had been blind for several years. Now, when I went ahead to ask what the problem was, to my dismay, she apparently had no idea what the cause of the blindness was. Of course, by virtue of my profession, I volunteered that since I was here, I would love to take a look at his eyes. So she begins to lead me from the living room through a narrow corridor into their bedroom, which was dimly lit, and there he was, Mr. Moses, sitting on an armchair, scantily dressed, bare-chested, with a pair of brown baggy trousers on, and his head was bowed down. His wife introduced our presence, and mentioned that I was the eye doctor from the teaching hospital that runs a community vision center in their community. Well, she meekly acknowledged my presence, and I approached him and asked that I would like to have his eyes examined, to which he agreed. Now, as I moved closer to him, I became apprehensive. Now, that was because immediately a short list of the common causes of preventable blindness was immediately projected to my mind. And there are lots of causes of preventable blindness, from uncorrected refractive errors. Technically, that means you need to wear glasses, but you're not wearing one and you're not seeing well, to other conditions like diabetes affecting the back of the eye, to age-related macular degeneration. But the one that came most to my mind was actually the commonest cause of irreversible blindness in Nigeria and globally, and the second commonest cause of moderate to severe visual impairment in Nigeria, which is glaucoma. So as I approached towards him, I was thinking, can it be if he had been blind for this long? He probably must have been seen by one of my colleagues somewhere, and they had given up hope on him. But as I advanced and I moved towards him, his visage became clearer, and at that point in time, memories of my own father started coming back to me. Now, my father, at the prime of his medical practice, lost his vision to a condition called chloroquine retinopathy. Now, chloroquine retinopathy is a medical condition affecting the eyes due to using large amounts of chloroquine over a long period of time. Now, I think it's right to say here that there isn't light at the end of every tunnel. There are some tunnels that actually terminate in dead ends. Now, as far as blindness is concerned, now, blindness, just like an eclipse, even though you may be able to localize the cause, but the effects are far-reaching and you can't privatize it. My dad lost his vision when my 5 siblings and I were still undergraduates at the University of Ibadan here, and you can only imagine, but you can't ever come close to it. If you have the breadwinner of a family losing his vision, because what happens to its dependents is that they almost come to the verge of begging for bread in the absence of succor or help anywhere else. And that was our case. Undergraduate days was very rough because technically we lost a breadwinner, even though he was alive, but productively he was gone. And that was my experience as I began to move now back to Mr. Moses, as I began to move closer to him, still being very apprehensive that what could be the cause. I brought out my pen touch, which we usually use in examining eyes, and I flashed my pen touch at his eyes. Lo and behold, a mixed feeling of emotions came over me. Number one, I was relieved. Relieved because what Mr. Moses had, after all, was just age-related cataracts, a condition that is easily treatable by a 15 minutes procedure. But I was dismayed because how could he have been blind for 15 years? Not just like my dad, had never set eyes on any of his grandchildren. My dad has 13 grandchildren and he has no idea what they look like. So I was startled. I was like, how can you be blind? In actual fact, he was literally under an house arrest for 15 years of his life, locked up, and he couldn't go out unassisted. Now, this brings us to the story of cataracts, which is a public health problem globally. Like I mentioned earlier on, it's a very treatable condition. Within 15 minutes, vision can be restored to that individual. Now, we have statistics locally, which shows us that in Nigeria, we have about 1 million people who are visually impaired and 1 million who are blind and 3 million that are visually impaired. So putting all together, visual impairment and blindness, we have about 4 million people who have difficulty seeing well. Now, 42 out of every 1,000 adults aged over 40 years are actually visually impaired or blind. And interestingly, most of the blindness and visual impairment is due to this treatable condition called cataract. Now, what are cataracts? Simply put, cataract is just the opacification of the viewfinder in the eye, which we refer to as the lens. As one ages, the lens begins to change its structure and begins to grow opaque. And I remember mentioning it, and I usually say this often, that if we all live long enough, all of us will have cataracts. Because it is typical. The most common cause of cataract is age-related. As you grow older and your hair begins to turn from black to gray to white, the lens in your eye also begins to change form. Now, this is worth knowing because a large burden of preventable blindness in our environment is due to cataract. So it's an opacification of the lens, and it starts gradually. It's one of those conditions that has a gradual, painless, progressive deterioration of vision. And it's so rampant in our environment. Now, the treatment is so simple for age-related cataract that has started to impair the individual's vision, and that is a procedure called cataract surgery. It has gone through a lot of modifications over time, such that right now it's one of the commonest eye surgeries being performed by ophthalmologists. Those are eye specialists trained in the treatment of medical and surgical diseases of the eye. The most common and one of the safest surgical procedures available everywhere. So, like I said, but before it gets to the stage of surgery, a lot of individuals have a lot of coping mechanisms. So imagine a world where every smile, every face, every detail begins to become blurry, fades into a blurry image. That is what happens in cataract. And like I said, the good news is there's a treatment. So, but a lot of people have adapted or have learned to come up with coping mechanisms to ensure that they cope with it, ranging from increasing the illumination, lighting in the house, to using handheld magnifiers, to rearranging the furniture in the house, to the use of assistive technology like text-to-speech, and using all kinds of technology to help them adapt. But the end result is usually blindness or visual impairment that needs surgery. I've been involved in taking care of people who have had cataract surgery, who have had cataract, and I've been involved in organizing so many outreaches within my state and outside the state, all across Nigeria, to ensure that these services are brought to the doorstep of so many people that are in need of it. Have had the opportunity to collaborate with non-governmental organizations, individuals, philanthropists, institutions, organizations that have partnered together with me to ensure that people are aware of this condition, because some of the difficulties in ensuring that people have access to quality eye care service, in this case cataract surgical services, one of them is the fact that people are unaware that such services exist. Number two is affordability. There are a number of people who cannot afford a cataract surgery. Three is the level of knowledge that they have. Then, fourthly, is the fact that the healthcare service providers, how available are they? So these are the problems that usually make it quite difficult for individuals to access surgery at the proper time. And the solutions are very simple. Number one is to ensure that there is an even distribution of eye care personnel ready to provide these services. Our observation is that you have a lot of eye care service providers, ophthalmologists, residing in urban areas. So most of us are clustered in general hospitals, teaching hospitals, and in the private sector, largely in the cities. And it's so hard for you to have a practicing ophthalmologist residing in the rural area. Another way out is to ensure that eye health care and routine eye examination is incorporated into primary health care. Our primary health care is so dysfunctional in terms of providing primary eye health. So a lot of people just stay at home until they go blind before they begin to seek for help. But care can actually be received at that level before they are being referred to see the specialist, either at the secondary healthcare level or the tertiary healthcare level. And lastly is the fact that we need more education, we need more publicity about the fact that there's such a thing as preventable blindness, and of course the most common cause is due to cataract. Now, having mentioned all of this, like I said earlier on, eye care service delivery is not a one-man's job. We work as a team, and I've been privileged over the years to work with a very formidable team made up of optometrists, public health nurses, ophthalmic nurses, health assistants, and camp organizers in ensuring that services are brought to the doorstep of people who are in need of it. As a matter of fact, in the last couple of years, we've been able to do hundreds of vision restoring cataract surgeries to individuals who are in need of it and cannot afford them. Our partnership with different organizations has made our work so easy. But all of this is just a tiny drop in an ocean. We all need to be evangelists. We need to be advocates. We need to be people who would go out there and mention that there is help available. So one of the things that is going to be your responsibility as you leave here today is to ensure for yourself, for your family, and for your community is to advocate at least an annual eye examination with an eye specialist. Because it's been found out that the reason why in low-income countries, middle and low-income countries like ours, one of the main reasons for the huge magnitude of preventable blindness that we have is due to the fact that people don't get detected early enough. And aside from that, they don't get treated early enough. Most of the common causes of visual impairment and blindness are treatable if they are detected early enough and if treatment starts very well on time. Now, let me go back to my story about Mr. Moses. I was able to convince him eventually that all he had was just a cataract and a 15-minute procedure would restore his vision. Well, he agreed to have the surgery done, and the other stumbling block for him was funds, finances. And successfully, I was able to arrange a sponsor to take care of his surgery. I was able to bring him back to the base hospital, in the tertiary hospital, where he had his surgery done. Now, the beauty of his experience was that the following day after his surgery, as I walked past his bedside, thinking he was still asleep, walked past his bedside and started greeting the nurses on the ward and some other colleagues. He was startled by the sound of my voice, and he woke up and he said, "That voice is familiar. Is that Dr. Ologundudu?" And he stood up, turned, and said, "Oh, you're the doctor that's been responsible for restoring my vision. I can see you. You're wearing a white shirt, you have a red tie on, you have a white overall on." And he was beaming with excitement and with so much joy. Now, this is a testimony that we see over and over and over and over again. Now, my charge to us today is to ask you to join forces with us in the work we've been doing. Like I mentioned earlier on, all we've been doing is just a drop in the ocean. We need help. We need partners. We need people who will be responsible for informing their communities about the fact that help is available. And I want you to imagine a world where every individual with preventable blindness has vision restored to him or her. That kind of world is possible if we all join forces together. Now, in closing, in the words of Jimmy Cliff, his song, the lyrics that says, "I can see clearly now, the rain is gone. I can see all the obstacles in my way. No more dark clouds that have blinded me. It's going to be a bright, 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 bright sunny day." This is our hope, this is our expectation that this will be the testimony of millions of people who have a form of blindness or the other that is treatable and is preventable. Thank you for listening.
Amazing.